And still to come, a look at dental care in the new decade. Stay with us. We'll be right back. Good oral hygiene can be critical to your overall health, and in this day and age, visiting the dentist doesn't have to be painful or frightening. Tonight we begin a series of visits by Dr. Bob LaCosse, an accredited member of the American Academy of Cosmetics and owner of Lake Dental Group in Duluth. And Dr. Bob, thank you for joining us on this cold afternoon.
Happy to be here, Michelle.
Well, tell us a little bit about yourself.
Well, as you mentioned, I'm a general dentist. I take care of people's general dental needs, but I also have kind of a focus or an emphasis in cosmetic dentistry, changing the way that people smile and their teeth look. We do a lot of this kind of thing. I'm pretty good at it, and it's really rewarding and a lot of fun.
And you can really have some dramatic results, and it must be real thrilling for you to see the change in your patients as they come through.
It's incredibly satisfying. We love it.
Now tell us a little bit, there's a lot of changes going on in the field of dentistry, especially when I was a kid and my brothers and sisters were marched off to the dentist. Things have changed a lot in the past 40, even the past 10 years. Tell us about some of the new innovations.
Well, as a dentist, Michelle, I'm kind of biased, but I really do believe that you know, the mouth and the teeth are one of the most important parts of your body. This area just gets incredible use every single day of your whole life. And if it's, you know, this is for speaking and for eating and for smiling, and if things aren't in good working order, it makes it hard to function in your own life and in society in general. So everybody needs a dentist. But the truth is only about 50% of the people in the country actually go to the dentist or have a dentist. So this is a problem. My question is, why is that? And it comes down to two factors as far as I can find out. Fear or cost. And any innovations or technology that we adapt really needs to address those issues if it's going to be important to the patients. Things like convenience and efficiency are also important, but secondary to the pain and the cost.
Well, I have to admit, things are very gentle in my adult life going to a dentist compared to when I was a kid. Things have changed dramatically. There's a lot of medications, a lot of pre-treatments before you get your anesthesia or anesthetic. Tell us about some of the other things you can do.
Well, the truth is, Michelle, that nothing should hurt in the dental office, and I know that's something new for a lot of people to hear, but with the newer techniques and the newer anesthetics, we can almost always remove pain from any procedure. Now, even though it doesn't hurt, a lot of people will think that doesn't make it comfortable, but we're making a lot of progress in that arena as well. It's not exactly like going to the spa yet, but with conveniences like ceiling-mounted televisions and headphones and in-office sedation and quieter drills and you know, a warm towel before you leave, our patients tell us that it can be really relaxing.
And of course you have a beautiful building, and the views from the suite there is just gorgeous, nice. If you have to just go for a tour of this office, it's very sweet.
Thank you.
Let's talk a little bit, briefly touch on the cosmetic dentistry. When people think, oh, like a lot of hockey players and people in sports might chip a tooth, knock a tooth out, does that fall into the cosmetics angle, or is that more of a surgical?
Well, all dentistry nowadays, Michelle, really should be cosmetic. There's no reason to make dentistry that isn't beautiful anymore. You know, if it's not cosmetic, what is it? It's ugly dentistry, and we don't do that anymore. But you know, functional issues play into this as well. A hockey accident, for instance, would certainly be covered under insurance most often, and we're not just making someone look good, we're restoring function as well. So certainly that would apply.
What about the efficiency? I know that this is something that really struck me as amazing. I went in for a crown recently, and that crown was put in one morning, and in less than 2 hours.
Yes.
It was in there. Where in the old days you had to go in, get fitted, wear a partial, or...
Exactly. People are busy. You know, no one wants to spend more time in the dental office than they absolutely have to. And this is an area, Michelle, where the new technology really shines. What you're talking about is CEREC technology. We have a machine nowadays, a computer-operated machine, where we can make crowns in one appointment. So there's no messy impression, there's no temporary that you have to deal with, there's no second appointment. So this is, you know, really an area where things are more efficient and convenient for the patient. Another example might be a process called air abrasion, where we have a device where we can do fillings without using the drill without even using Novocaine sometimes. It's more like a small sandblaster where we can spray away the decay, and that makes things more efficient and convenient as well.
That's amazing. So for the 50% who are not going to the dentist, really quick, we're out of time, but they should at least get in for a checkup once a year.
Absolutely. Prevention is the best insurance you can buy. Brush, floss, see your dentist regularly.
Okay, thank you very much, Dr. LaCosse. Dr. Bob, great to see you again. And we will be right back after this. Stay with us.